Giving a diabetic cat insulin injections can be a challenging task, but with time and practice, it can be a daily routine just like any other. Before attempting to give your cat any injections, you should first ask your veterinarian to demonstrate the proper method of giving insulin. To get started, make sure you're using the correct syringe for the type of insulin you'll be giving. In this demonstration, we'll be using Prozinc, which requires a U40 syringe. Your veterinarian will inform you of the insulin type and syringe needed for your cat. Diabetic pets should always be maintained on a strict schedule for feeding and giving insulin. To prevent hypoglycemia, we recommend feeding your cat 20 minutes prior to the injection. However, you should always consult your veterinarian. Next, gather all the necessary items and place them nearby. These items will include the insulin vial, a syringe, a sharps container for disposal, and your cat's favorite treats. Take the insulin vial and rub it between your hands. This helps to warm up the medication, and it also mixes the molecules. It's important to avoid shaking the vial, which can cause air bubbles or make the insulin less effective. Next, remove the caps from the syringe. Pull the plunger back until the black stopper aligns with the prescribed unit dose. Using a flat surface, hold the vial down and insert the needle into the top and gently push the plunger down. This process releases air into the vial, making it easier to draw the insulin into the syringe. Now that air is inside, turn the vial and syringe upside down so the vial is on top of the syringe. Slowly pull the plunger back with your fingers until the top of the black stopper is even with the correct dose. If air bubbles appear in the syringe, lightly tap the side of the syringe and push the insulin back into the vial and restart the process. Next, make sure your cat is at ease. Help encourage this behavior by petting your cat for several minutes before an injection. Cats can have insulin injected into the scruff, side of the chest, side of the belly, or the flank. Once you've chosen an injection site, pinch a couple of inches of skin in between your fingers and pull away from the muscle. Using the syringe, quickly inject the needle into the fold of skin, making sure the needle does not come out of the other end of the skin. Push the plunger down to inject the insulin into your cat's skin, leaving it for 2 to 3 seconds to ensure all of the medication is released. After removing the needle, rub the injection site. If you notice any wet spots, this means some or all of the insulin was not administered. If this happens, do not give another injection. Simply wait until the next scheduled injection time. A good habit to consider is to follow each injection with a treat, since this will help your cat associate the injection with a reward. After each injection, it's important that you never reuse any insulin needles. All syringes should be properly disposed of using a sharps container. If you're unsure of how to dispose of them, contact your local waste management for proper disposal procedures. At 1-800-PetMeds, we're dedicated to helping your cat maintain a healthy and happy life. For more information on pet supplies for diabetic pets, visit PetMeds.com.